Hardy.
Thank you, Mr Deputy Speaker, and I'd like to start by paying tribute to all of those health and social care workers right across my constituency of Hull, West and Hessle. They have my deeply felt thanks and gratitude. But I want to concentrate my speech today on my role as chair of the all-party parliamentary group for vascular and venous disease, because I'm deeply concerned by the impact COVID-19 has had upon people suffering from vascular disease. I've spoken of this disease before. It's a killer disease that few people seem to know about, despite it causing such devastation to so many lives. And between 15 and 20% of British people over the age of 70 are affected by peripheral artery disease. It can cause painful chronic ulcers in the legs and is the main cause of amputations in England. And as I've said before, every hour in England, someone has part of their foot removed. Every 2 hours in England, somebody loses their leg. And as chair, I've heard evidence from NHS frontline workers and patient representatives deeply concerned by the burden experience of people with vascular disease during this crisis. Because during this crisis, vascular services have experienced a reduction in their capacity to deliver care. And some people with vascular disease are too frightened to seek treatment. As Mr Naz Ahmad, the Manchester Amputation Reduction Strategy Director, said, one of the biggest problems we face is fear. I fear that the lack of a comprehensive and universal COVID testing regime, combined with stories of patients who enter hospital COVID-free only to contract the disease while in hospital, is driving this fear. This has inevitably led to people who would otherwise have taken themselves to hospital staying at home while their condition worsens. And to make matters worse, clinicians expressed fears that many people who have had their non-urgent operations cancelled may have deteriorated since that decision was made. Yeah.
I'm very grateful for the Honourable Lady giving way. Does she agree with me that for patients with peripheral arterial disease, that it's urgent referral, which is often the difference to saving a limb? And unfortunately, due to this COVID crisis, that urgent referral to secondary care, to multidisciplinary teams, may not have happened. And we must be guarded against that as we try to save limbs.
Honourable Member for his intervention, and absolutely agree with that. As I'm going to come on to in a minute, as Dr Dan Carradine says, who's a leading consultant on this issue in the University of Hull, in the Hull Royal Infirmary, he says time is tissue. And the more quickly we can deal with this, the more urgently we can save limbs. But because of this delay, we are already seeing a growing rate of lower limb amputations being performed in the past few months, many of which could have been avoided with appropriate timely diagnosis and treatment. We cannot allow this situation to continue. Patients must be confident that they can visit their hospital safely. And one vital way the government could try and restore trust is to have this routine weekly testing programme for NHS and social care staff, so patients know when they enter hospital they are not likely to contract COVID-19. Because every day the number of people seeking treatment is growing. Dr Una Adderley, the Programme Director of the National Wound Care Strategy, has described it as, I quote, a tsunami of unmet need on the horizon, as certain vascular services have been deprioritised. And I recognise the huge pressure that the NHS is under, of course. But I still believe that more can be achieved for people with vascular disease if they are given the focus they need. We need to create safe COVID-19 negative pathways and services for vascular disease in both the community and hospitals. And I recognise these are not straightforward tasks, and I will be writing to the Secretary of State as chair of the all-party parliamentary group with further details on exactly how this could be achieved. But we also need a comprehensive approach toward vascular disease in the NHS long-term plan, because there are huge regional inequalities, with patients in Hull being 46% more likely to need a major amputation than the England average. As I said before, time is tissue, and so I look forward to getting a date in the diary for the Minister of State of Health to visit Hull, as he promised at a previous debate, but of course as soon as it is safe to do so. I just want to finish by saying that I note that the Government wishes to change the wording of this motion, away from the need for a weekly testing programme, to instead celebrating and recognising their own efforts. With the greatest of respect to the government, the highest and most well-regarded praise tends not to be written by oneself. And so I would encourage the government to seek to earn that praise rather than pen their own. And one way in which they could do that would be to prioritise the hundreds of thousands of patients suffering in the UK from vascular disease.